The Omicron variant was first discovered in South Africa, and it's now spreading rapidly around the world.
So, what can South Africa's real-world experience tell us about the way Omicron will behave in the UK?
Variant B11529 was first spotted in early November by lab technicians in Pretoria, and that discovery would trigger a global panic.
The UK Health Security Agency is raising concerns about a newly identified variant.
The variant was heavily mutated, and scientists worried these mutations would make it more infectious and more dangerous than the last dominant strain.
Omicron's ability to infect large numbers of people in South Africa has already been established.
Its transmissibility has been demonstrated through COVID tests performed in the private and public sector. But most South Africans don't get tested when they're sick. The tests are too expensive. However, there is a wealth of anecdotal evidence about the infectious nature of this strain. In places like Alexandra Township in Johannesburg, the variant is now surging through the community.
Have you got a sense for how many people have been infected here?
A lot of people. I mean, on a daily basis, I interact with around 100 to 200 people. The majority of those people were all saying that they have flu.
It is more difficult to assess the severity of Omicron, although the South African experience is providing important clues.
Well, I've had a headache, blocked nose, wasn't too runny. I've been coughing.
On a scale of 1 to 10 for severity, what would you give it?
A 4, honestly.
A 4.
Because it wasn't that bad.
Pretoria's Steve Biko Academic Hospital is located at the epicenter of this outbreak, and staff have made a series of important observations. There are fewer people exhibiting the most serious symptoms, and COVID patients are less likely to need oxygen or ventilators. Those infected with Omicron tend to spend less time in hospital in comparison with other variants. All of this has given staff some room for optimism.
Right now we have 40 patients, either COVID positive or waiting for their results. But the difference this time around is that the majority of these patients are not here because of a severe COVID pneumonia.
Scientists say vaccines, like the Pfizer jab, should prevent severe disease or death. And that's good news for Britain, where the majority of people have been vaccinated. But it's bad news for South Africa, where less than a third have been jabbed. Still, scientific surveys show around 60% of South Africans have developed antibodies after catching earlier strains of COVID.
And this could explain why some people who've been infected by Omicron have not experienced the most severe forms of the disease.
Was pleasantly surprised, actually. Most of the patients were breathing normally on room air, 2/3 of them, so the picture could change. But what's certain is that there is a difference this time around compared to the previous 3 waves.
The pandemic has ushered in 18 months of pain for South Africa, and Omicron's arrival makes it worse.
After South African scientists identified this variant of concern, many countries implemented travel bans, which were designed to cut South Africa off. And that's damaged an economy in desperate need of tourist dollars and general investment, and it's angered large swathes of the population.
However, after 4 waves of infection over the past 18 months, this country has the experience and the experts to see it through.